As always on the show, I want to show you the big picture in India's battle against the coronavirus on the Corona India dashboard. I'll start with the India numbers. 28,160 confirmed cases of COVID-19 patients, 886 deaths, 6,362 recoveries. When we go state by state, it is Maharashtra, which has the maximum number of cases in the country, crossing 8,000 at this moment with 342 deaths. Gujarat is now firmly ensconced in the second position with 3,301 confirmed cases, 313 deaths. In fact, in Gujarat now, in Ahmedabad, there is a concern about an L strain of the coronavirus, which essentially means a more strong strain of COVID-19 in comparison with what we'd seen elsewhere. That's led to a lot of concern in Ahmedabad and in Indore. I'll delve into that at 8:30 p.m. This evening. At number 3 in the list of most impacted states is Delhi, touching almost 2,918 and 54 deaths. I want to show you the trajectory marker for India. Now, if you look at the graph of different states, what you need to look out for is the incline of each of these curves. Right at the top at this moment is Gujarat, the state which is seeing the fastest spread of infection. That's the number 1 state and the biggest area of concern. Then there is Maharashtra, which again continues to remain an important area of concern. And last, there is Delhi. These are the 3 troublesome states that we're looking at very, very closely. What the government has started to do now is look at these containment zones, and we'll build on that on the broadcast this evening. Areas that are green are areas where life is likely to start returning towards normalcy post the 3rd of May or the new normal. The districts which are marked in red, dark red, are districts which will be considered hotspots, and there'll be lots of very stringent conditions of the kind that we've seen for the past 1 month. So we'll build on that. We'll also look at what the medical view on this is. So we'll have top experts, epidemiologists, some of India's leading epidemiologists, some of the leading global epidemiologists joining us on the broadcast at 8:30 p.m. to talk about, we're hearing netas speak, we're hearing chief ministers speak, we're hearing economists speak, but what's the medical view? I'll build on the medical view on the most optimal exit strategy for India at 8:30 p.m. This morning there was a crucial meeting between state chief ministers and Prime Minister Narendra Modi, where the states laid out their expectations from the centre and the roadmap they preferred post the 3rd of May. Now, what's interesting and important is that most states want the lockdown to be extended, especially in containment zones, the hotspot areas. The Prime Minister said in areas which are green zones, which are relatively unimpacted by the virus, there the state chief ministers need to start working on easing restrictions so that life can start returning to a near sense of normalcy. So you maintain social distancing, but if you're in a green zone, then all the very stringent conditions that have been placed till now, those will start easing post the 3rd of May. Here is our lead story tonight.
A week to go for lockdown 2, Prime Minister Narendra Modi chaired a meeting with chief ministers to decide on an exit strategy. At the end of the marathon meeting, one thing became clear: the lockdown could continue in COVID red zones, but with more relaxation in other areas. Sources have told India Today the Prime Minister has asked the Chief Minister to decide on lifting the curbs based on red, orange and green zones in their states. Prime Minister also told the Chief Ministers to prepare a detailed plan on how to ensure a phased exit from the lockdown. 9 Chief Ministers spoke during the meeting, addressing several concerns in the COVID fight. 4 Chief Ministers, including Naveen Patnaik, were in favour of extending the lockdown. The Odisha Chief Minister wants the lockdown to be extended by at least another month.
आमच्या म्हणण्याचं की लॉकडाऊन एक्सटेंड करतो म्हणल्यार इकॉनॉमिकल हेजे आसा एक्टिविटीज ज्यो आसा विदीन द स्टेट इट शूड कंटिन्यू. बॉर्डर सील उरच्यो. देयर इज नो ट्रेन, नो प्लेन, नो पब्लिक
अभी दिल्ली को लेकर जो तस्वीर दिखाई दे रही है वो 3 मई के बाद, मतलब 3 मई करीब आने पे ही तय होगा, और 2-3 दिन बाद सारे स्थितियों का आकलन करते रह के तय कर पाएंगे.
Several chief ministers demanded funds from the centre.
The government of India should give us an economic package. we are giving rise to the families also. Therefore, the government of Puducherry has to be financially helped by the government of India.
The Prime Minister assured the Chief Ministers the economy is in good shape. He seemed to suggest a two-pronged approach. Continue the fight against the virus while giving importance to the economy.
The lockdown is all set to be extended for the second time. But this time around, the states will be driving it. And they will be deciding where to ease the restrictions and where to keep the containment extremely strict. With Bureau Inputs, Rahul Srivastava for India Today.
So here is broadly what you're looking at post the 3rd of May. Look out for the district that you're in, and if you're in a green zone, then restrictions will be eased. If you're in a red zone, then the restrictions will largely stay. When the government last released data, there were 123 hotspot districts with large outbreaks, 47 districts which had clusters, 207 non-hotspots districts with a few cases, and 350 non-infected districts. Now, non-infected districts can very quickly see life returning to a near sense of normalcy, whereas the 123 hotspot districts will see restrictions continue. But there's a lot that needs to be thought about, even in the manner in which we go about planning this exit strategy. Because if, for example, you've got one district, District A, with lots of cases, and another district, District B, which doesn't have cases, and in District B life starts returning to normal, people will go meet each other, suddenly the number of cases could start spiking, and that can create problems. One person who's been thinking very deeply about what the lockdown exit strategy could be is Professor Vipul Mathur. He is Professor of Economics at the Indian Institute of Management in Kolkata. He's written a piece that's been tracked very closely. We invited him to join us on this broadcast. Also with us on the show is Samir Saran, President of the Observer Research Foundation, one of Asia's top, most influential think tanks. And Pawan Verma is a former officer of the Indian Foreign Services, has been Chief Minister's advisor in Bihar. So welcome. I want to go across to Samir Saran first. Samir, if you look at the government's plan, it seems to be a three-way process. One, if you're in a red-hot district with lots of outbreaks, then life stays locked in. If you're in a green zone, then they want people to start returning to a near sense of normal. And if you're in an orange zone, somewhere in the middle, there will be some restrictions, but there'll be some calibrated easing of the lockdown. Do you think that will be the right way to go for a country like India, Samir?
Rahul, that may be the intention, but it's not that simple, as you have yourself described earlier in your remarks, that it's very difficult to have these rigid boundaries separating green, red, and orange, if I was to call it that. I think there are two big challenges before this government, and let me just try and quantify it. You, of course, have mentioned that there are a large number of districts, 350 districts, if I heard you correctly, which have not yet had COVID cases or which are not infected. And therefore, you are suggesting that perhaps we could have a more normal routine implemented there, a more normal life being conducted after May 3rd. Now, it's not that simple. Many of these districts have very few isolation beds. If you were to have an infection spread in those districts, I mean, let me give you a number. There are 183 districts across the country that have less than 100 isolation beds. And a large number of them have not seen infection yet. As many as 53 districts in UP have fewer than 100 isolation beds. So now, again, only 31 have seen infection till now. The others have not. The point I'm trying to make is that while having green, orange, and red are good colors, these have to be accompanied by antibody seroprevalence surveys before we decide what we want to do with them. So I think testing green zones is extremely important so that we don't have asymptomatic carriers, we don't have spurts and a rise in infection rates in many districts, which can be overwhelmed. I think one is testing has to accompany any form of relaxation, number one. Number two, I think in every zone, PPE, personal protective equipment, and clinical gear to our healthcare staff is absolutely essential. Just because a zone is green doesn't mean that our healthcare workers can't be infected in those zones. We have seen how it has happened earlier. So I think we have to take extreme care in certain critical infrastructure, and medical infrastructure is extremely critical at this moment. Irrespective of the zone they belong in, they have to be treated to be red zones.
Professor Vipul Mathur, you wrote a piece about the problems with demarcating districts as District A and B. Why don't you explain to our viewers what your concerns are and what you think of the strategy the government is currently working on?
Okay, so thanks a lot for inviting me here. What I have actually tried to attempt is essentially trying to add one more layer to these arguments that largely make sense, and that dimension is essentially of an economic contact intensity. And the idea is that at the heart of both the virus transmission and the economic activity is a human-to-human interaction. So while we are trying to mitigate the impact of virus, we are also impeding the economic activity. And there is a knife-edge path that we have to travel in order to optimally balance the both. So the one way to think about these things is to actually move away from the conventional geographical maps and look at the whole Indian economy as occupational maps. Okay, let me explain. So at the level of occupations, we are dealing with a wide variety of occupations which involve different level of contact or proximity that we have to deal with. And as we are going to unwind the lockdown, we can gradually start unwinding those occupations first, which involve a lesser degree of contact. And eventually, when we would have broken the back of the virus enough, we can start unwinding the lockdown in areas, in occupations which involve higher contact intensity.
So build on this theory of economic contact intensity. What are the kind of occupations that you think can be re-allowed post the 3rd of May? And what are the kind of occupations you think we'll need to put a hold on for much longer than the 3rd of May?
So I think sectors inherently which are less contact intensive are sectors such as forestry, fishing, heavy machinery, machine tools, finance, insurance, business services, consulting, telecommunications, electric, gas, water supply, etc. Whereas on the other hand, sectors which are highly contact intensive are sectors such as education. Banking is also between mid to high contact intensive. So I think one has to look at these occupations in the Indian context and try to understand the whole spectrum on which they fall in terms of their economic contact intensity.
So that's an interesting paradigm to think about. Don't just think about the nature of the district or the number of cases there, think about the intensity of the economic contact.
I think the unit of analysis should move away from the district or the administrative units, and we should start looking at the occupational maps of India, then the conventional demographic or the district administrative maps.
Interesting insights from the IIM professor there. Now, Pawan Verma, you're making a point that the lockdown itself should end largely. However, if I show you what chief ministers said today, virtually all chief ministers, regardless of what their political affiliation was, they're asking for the lockdown to be extended. So it's not as if it's only BJP chief ministers who are saying what the Prime Minister wants to hear. Even non-BJP chief ministers are asking for the lockdown to be extended, which clearly means that they see rationale in continuation of the lockdown. Why don't you, Pawan Verma?
Very simply put, Rahul, it's not any more sustainable as a binary that we fight the coronavirus and keep the economy shut. I think that much has been made clear in this meeting, and I think that is the overall consensus. We have to do both. It's a difficult choice, no doubt, but it's not either or one against the other. Secondly, I want to say to you that if we must put the economy gradually on its feet, we've got to get rid of the underlying assumption that opening up the economy and getting it running is somehow antithetical to our fight against the coronavirus, because, frankly, both the center and the state need resources. If they don't earn resources, how are they going to take on this pandemic in terms of both fighting it and providing ameliorative care and the fiscal stimulus the economy needs? Thirdly, frankly, I find it very difficult to understand how we can divide the economy into either occupational or geographical zones in a very compartmentalized way, rigidly, inflexibly, because the economy is a holistic one. It's a complete whole. Yes, there are very easily earmarked hot zones or red zones which need to be specially looked after. But just now, Haryana has announced that no one from Delhi can enter it unless you have a permit. Now, there are people from Delhi who work in Haryana or in Gurgaon and vice versa. If you open up the economy and yet allow this kind of draconian measure to be taken all of a sudden, you're going to
so
fall
what's your
flat.
suggestion? What you're stating is true, and we're in an unprecedented world at this moment. What's your suggestion? To find fault with what the government is doing is one thing. Do you have some meaningful suggestion to offer?
Yes, I would like to suggest that please don't pursue the opening up of the economy as if it is a piece of calibration being done on a game you are playing inside your office. It's not possible. I would suggest that the lockdown has, and just give me 30 seconds now, Rahul. The lockdown has served its purpose. We needed it. The government did the right thing. It has sensitized people to social distancing. It has reduced the transmission rate. It has given us time to upgrade health infrastructure. Now, like most countries, we've got to look towards making the economy stand on its feet. And for that, Rahul, my worry is, and this is my suggestion, a police-led bandobast with vast discretionary powers with bureaucrats on the ground. An industrialist called me and said, I have been told you can open your plant where there are 12,000 workers employed, but if one case of coronavirus occurs, the district magistrate can say that for 3 months your plant will be closed. Now, which employer will start with activity with this Damocles sword hanging over him? So don't do it half-heartedly. Take a firm stand that it cannot be sequential anymore, Rahul, that the last coronavirus ends and then we begin the economy. We have to literally fight the coronavirus and fight to keep to make the economy recuperate and stand on its feet. No. Now, if that is the case, we must allow it to do so.
Samir
Saran, chief ministers, last point I want to make, chief ministers of states, some of them, I'm sorry to use the phrase, and I'm not saying BJP or otherwise, some of them are suffering from what I call decisional inertia, which is to continue to keep doing what you are doing without any creative or realistic options to what you are doing. So therefore, you can't just say police-led bandobast, lock people in. In any case, that has limited returns now because it is physically impossible to carry out self-isolating and social distancing norms in the kind of circumstances the majority of the population in India lives.
Okay, so Samir Saran, you've been making a point about a smart lockdown, and you've been focusing on the on ORF, on test. But the reality is, when we imported all these rapid testing kits, they turned out to be faulty, and the Indian government, the ICMR, has now said don't use these kits because the variations are so high. So the point that you made last time you came on my show was ramp up testing capacities. That was attempted, but now it's come a cropper, Samir.
No, we have lost time, and no doubt it's a setback. And I had hoped that by the time we reach May 3rd, we would have been able to do some of the pool testings and wider testings to actually establish zones that are safer for certain kind of activities. I agree both with Vipul and both with Ambassador Verma. Vipul is absolutely right. We have to be careful about certain forms of trade and business. But Ambassador Verma is perhaps even more pragmatic in his assessment that when you begin your economic activity, it is very difficult to limit it through rigid boundaries or rigid locations. I will give you a case in point. We are going through the cultivation season now. We are having people who are going to be taking crops, moving to mandis, crossing states. You will have people who are working on farms, moving across borders. These are pretty, high contact activities. You've seen even in our daily procurement of vegetables for our own home, we are crowding. So what I'm saying is it's very difficult to be able to contain human contact beyond a certain point. We have to still try our best. We have to keep testing wider. We have to be able to now confront certain spurts that may take place at certain zones. And we have to have what someone recently termed as the mobile wards available to go to various zones where we might have certain breakouts. We should be able to have green zones and be prepared to move them back into a containment area if something happens. But Ambassador Verma is right. We have to coexist with this challenge for the next 12 to 18 months.
Okay, so
now, as a country which is at $2,000 per capita income, please believe me that we are killing ourselves by not acting immediately. Economic activity is important for us to be able to respond to the virus. It is not, we are not ignoring the virus by going into a new phase of economic activity. We are actually strengthening our abilities to respond to that challenge the virus poses to us.
Okay, I want to show our viewers what's happening globally. What's being said really sets the stage for us to zoom out for a moment, look at the world map, and then compare what's happening in India with what's happening globally. So let's see how long the lockdown has been on for in different countries of the world and how that compares with India. What you'll see on the chart behind you is really how long the lockdown's been on in India vis-a-vis elsewhere and what date does it go on till. So in Italy, the lockdown was for 57 days. It ends on the 3rd of May in Lombardy in Italy, in Wuhan. The lockdown's now over. It ended on the 8th of April. It lasted for 77 days. In Spain, the lockdown is for 57 days. It goes on till the 9th of May. In France, the lockdown is for 56 days. Started on the 17th of March, goes on till the 11th of May. In India, the lockdown started on the 25th of March, it goes on till the 3rd of May, and it's a 40-day lockdown. So in comparison with other countries of the world, the Indian lockdown is actually smaller. So it isn't, Pawan Verma, as if the Indian lockdown is much longer than the global lockdown. In fact, the Indian lockdown at this moment is much smaller than countries like China, Italy, Spain and France, which have far more advanced and sophisticated medical care facilities, which India doesn't if this virus starts to go out of control.
Well, you know, Rahul, all evidence so far, and I'm not trying to be over-optimistic, all evidence seems to point that contrary to expectation, the fatality rate in India has been surprisingly and happily much lower. The number of cases will go up as testing increases, but there is no doubt that fatality rates are lower. And so I believe that every country must make decisions in accordance with its own assessment of the impact of the disease. Secondly, the suffering in countries like India, where the social safety security net has not been as extensively developed as some of the developed countries, is far beyond sustenance. The poor, the marginalized, the deprived, the underbelly of our economy, which constitutes the overwhelming majority of our people, are bearing a disproportionate burden of the lockdown because, as you yourself said, we have millions upon millions of people who must earn every day to eat at night.
Sure.
And they are living in conditions where a lockdown in any case is not efficacious. So therefore, a country has to decide in accordance with its own situation. And while I believe that we should be sensitive to the fact that there are some zones which definitely need to be contained, but on the whole, India must take a decision keeping its own realities in mind.
Okay, Samir Saran, Pawan Verma, Professor Vipul Mathur, thank you for joining me on the Newstrack tonight and share your varied but very sharp. I want to show our viewers now what different countries did. A report from virtually all across the world where we show you how life is after the lockdown has started easing, which gives us some sense of how other nations are dealing with the same situation.
7 weeks after it went into a complete lockdown, Italy, one of the most coronavirus-infected countries in the world, has unveiled its plans for easing of restrictions. Italy's full lockdown is set to end on 3rd May, but people's movement will still be restricted, with schools likely to remain shut till September. The Italian Prime Minister has already given the go-ahead for professional sports teams to start training again in May. Majority of Italy's industry, including factories that are geared towards exports and public construction projects, will restart from May 4, a day after the lockdown expires.
More, we plan to reopen with all due precautions also on May 18th. Museums, exhibitions and libraries as well as training for team sports. Then June the 18th we anticipate is the date for... June the 1st is the date when we would like to open bars, restaurants, beauty salons and massage centres, so all activities related to self-care.
Britain, which was slower than countries in Europe to announce a lockdown, is also outlining plans for easing curbs. British Prime Minister Boris Johnson, who's back at 10 Downing Street after recovering from coronavirus, has warned that tough decisions will have to be taken.
I can see the long-term consequences of lockdown as clearly as anyone. And so, yes, I entirely share your urgency. It's the government's urgency. And yet we must also recognise the risk of a second spike, the risk of losing control of that virus and letting the reproduction rate go back over 1.
New Zealand's cafes and restaurants are also preparing to reopen for takeaway meals for the first time in more than a month as the country begins to ease its way out of a strict lockdown that successfully slowed the spread of the coronavirus. Around 4 lakh people will return to work on Tuesday after the country shifts its alert level down a notch at midnight on Monday.
Of course, the ambition we all have is to confidently reach the position where we can bring back the social contact that we all miss. But to do it confidently, we need to move slowly and we need to move cautiously. We must make sure that we do not let the virus run away on us again and cause a new wave of cases and deaths.
In the coronavirus epicenter of Wuhan, China, life is slowly returning to normal after the 76-day lockdown was lifted. While travel curbs have been eased, prevention measures such as wearing masks and temperature checks are still in place. As the world continues to fight the spread of COVID-19, it's also battling another big dilemma: whether to continue to be completely shut down, the economic ramifications of which will be huge, or to slowly get back to normal. Bureau Report, India Today.
We've got breaking news coming in that the union government is working on a proposal to guarantee loans up to 3 lakh crore rupees for small and medium-sized enterprises. Joining us for more on this story is our National Affairs Editor Rahul Kanwal. Everybody's been wondering when the second package comes and what's taking so long. 3 lakh crores. That seems to be a very significant commitment on the government's part. What more can you tell us, Rahul?
Well, it's a very interesting proposal. It's in the works right now. And what can be said that in countries like South Korea and Japan, this has become one of the global best practices. Usually when there is any business or entity which is smaller in character, is any kind of business distress or financial distress, banks and other financial institutions don't lend to them. And what they are looking for whenever they lend to these people is mortgage or some kind. And that's where lies the catch. The proposal catches on to that very idea. Government of India already has something called a credit guarantee trust. Now, this trust was formed as a kind of a corpus, which is always there for entities that they can, in case business entities are in trouble, they can be lent some money, and banks can be given some guarantee on part of the government. Now, the government guarantees 75% odd fund. Banks have no problem because there is a guarantor like the government. They lend the seed money and these entities can revive themselves. Now, there are 15 lakh crore outstanding loans in the country. Now, the government is looking at 3 lakh crore. In case the government increases the corpus, say 20,000 crore rupees in this trust, banks can be given the guarantee for 3 lakh crore funds. That will mean these entities will get seed money and they can start rolling.
Now,
so
remember,
the idea
there's been a huge concern about
guarantee
the sustainability of small and medium enterprises. There was a study that came out which said 25 to 30% of small companies could shut down. Rahul Kanwal says that the government is working on a 3 lakh crore rupee plan, which is to be announced over the next couple of days. We'll track that closely. We're slipping into a break. Welcome back. Now, one of the things that gave India some comfort was that the strain of the virus that had been seen so far was the less virulent strain of COVID-19, the less deadly strain. Now, what seems to have happened, at least in Indore and in Ahmedabad, is that there are concerns about the L strain, the same strain that wreaked havoc in the Wuhan area of China, in several parts of the United States and in Italy, that same strain could have come in here as well, which is leading to a higher mortality rate. Now, samples from there have been taken by the local administration and sent to the National Institute of Virology in Pune. So there's no need for panic just yet. But local officials believe that from the medical evidence they have at hand so far, that the strain of the virus they're dealing with in pockets of Madhya Pradesh and in Gujarat is stronger and more dangerous than the COVID strain that we were dealing with so far. Take a look.
As India battles it out in the pandemic theatre, hoping to stem the wrath of a raging virus, the virus itself seems to be extracting a higher price from two states of the country, Gujarat and Madhya Pradesh. To be precise, Ahmedabad in Gujarat and Indore in Madhya Pradesh. Gujarat till now has recorded 151 COVID-19 deaths. 104 from them came from Ahmedabad. Madhya Pradesh has recorded 103 COVID-19 deaths. 60 of them have come from Indore. The mortality rate of the states registering maximum fatalities in Ahmedabad and Indore is much higher than the entire country. As deaths started to peak in these two states, so did interest on why the higher death rate. Red flags were raised whether these two states were witness to a more virulent strain of the coronavirus. The L strain, deadlier, more aggressive, empirically registering a higher mortality rate than the S strain of the virus. That doubt has now sadly been confirmed for the state of Gujarat.
दो प्रकार के इस वायरस के स्ट्रेन हैं, एक एस स्ट्रेन जो उतना घातक नहीं है और दूसरा है एक एल स्ट्रेन जिसकी ज़्यादा एक विरुलेंट जिसकी असर ज़्यादा होती है। तो इसकी भी एक अनुसंधान रिसर्च हमारे साइंटिस्ट कर रहे हैं और माना जा रहा है कि शायद इस स्ट्रेन गुजरात में है, इस वजह से ये थोड़ा इस तरह से मृत्यु के अंक भी बढ़ रहे हैं।
From Madhya Pradesh, it's a fatalistic wait. Investigations of samples have been sent to confirm strain of the coronavirus.
पूरे विश्व में यह पाया गया है कि कोरोना वायरस की अलग-अलग जीन्स हैं जिनके स्ट्रेन्स अलग-अलग हैं। तो नेशनल इंस्टीट्यूट ऑफ वायरोलॉजी पुणे में यह स्टडी की जानी है कि अलग-अलग स्थानों के सैंपल्स लेके कि वो उनकी स्ट्रेन्स की स्टडी करेंगे, उसका कल्चर करेंगे, ऑटोमेटेड जीन एक्सट्रैक्शन करेंगे।
Medical research has now pointed towards two major strains of COVID-19, L and S. Whereas the L type was more prevalent in the early stages of the outbreak in Wuhan, it is also more aggressive, spreads more quickly. On the other hand, the S type, which is an evolutionary older and a less aggressive strain, might be relatively weaker and doesn't spread as quickly as the L strain. The dominance of this more aggressive Wuhan L strain is what experts now believe is causing the higher COVID-19 mortality rates in Gujarat and possibly now the state of Madhya Pradesh. Bureau Report, India Today.
It's of huge concern because if the L strain of the COVID-19, which is the deadliest strain, has indeed struck in Ahmedabad and in Indore, that could create problems. But what could those problems be? What is our best strategy to deal with this? For perspective on this, I'm joined on this broadcast by Dr. Ashish Jha. He's the director of the Harvard Health Institute. Dr. Jaiprakash Mullayal is one of India's foremost epidemiologists, former principal of the Christian Medical College. And for a perspective on the modeling that's just happened, I'm joined by Dr. Santosh Ansumuli. He is a professor at the Jawaharlal Nehru Center for Advanced Scientific Research. So, Dr. Jha, welcome to you first in Boston. Can you explain, because you've been looking at L versus S world over, how problematic is this for India that in Indore and in Ahmedabad, local officials believe, even though the Pune National Virology Laboratory hasn't confirmed this, that they are now dealing with the L strain of the virus?
Yeah. So Rahul, thanks for having me back. So there are many strains of this virus. L and S are the ones that we identified early as two kind of dominant ones, and there is some evidence that the L strain is more deadly, and as your reporter said, spreads more quickly. We don't totally understand why some strains seem to hit certain areas more than others. We've seen this in the US. There's some evidence that a deadlier strain might have hit New York than the west coast of the United States. And it may just be an evolutionary thing. And so whether different strains are hitting different parts of India, I think we still need to sort out. But certainly that is a concern. And to the extent that that's causing higher mortality.
Now that we've seen what happened in New York, we've seen what happened in Wuhan. Yeah. Because in Shanghai and Beijing, apparently it was the S strain. In Wuhan, it was the L strain. We've seen also what happened in Italy. What, according to you, Dr. Jha, are the best policy maneuvers India can make at this moment in these states where people would naturally be very concerned about the L strain running havoc like it did in New York and in Italy?
Yeah, so first of all, a couple of things. I mean, we don't know that treatments are going to be any different for these two strains. We don't know that a vaccine that we might develop for one strain won't work for the other. And my guess is that it will. So I think, first of all, people need to know that the things we've been doing, the looking for a vaccine, working on therapies, should work for both of them. Obviously, if you have a deadlier form of the disease happening in your community, it means more aggressive social distancing, more interest and focus on trying to do testing and isolation. All of those policies have to be done much more vigorously, because those are right now the only tools we have for preventing the spread of this disease.
What's your sense of what India should do post the 3rd of May? We're hearing chief ministers, bureaucrats come up with their perspective, sitting where you are, looking at the global picture. What would your post 3rd May, when the second phase of the lockdown ends, strategy be?
Yeah, so, you know, the lockdown, which I have said to you before, I supported, I think it was a good policy, has been, of course, enormously expensive. It's been costly in terms of starvation, people losing livelihoods, people dying. So I think it is time to be very data-driven in areas with low number of cases and good testing capacity. I think you can begin to relax some of the restrictions.
But there are no places with good testing capacity. We tried to build testing capacity by importing these rapid testing kits from China. That didn't work out well. Most of those kits don't work. And now the ICMR has said, don't use these kits. So testing capacity is a no-go.
I know. We got to keep working on it, right? This is not a yes or no. You've got to keep working on testing capacity. But also, we can't wait until testing capacity is fully up and running. But this has to be, in my mind, the #1 priority of the government, is ramping up testing capacity, because it will let you use evidence and data to know where you can relax the restrictions.
No, sir. Now that's not possible, because the 3rd of May is just a few days away. Testing capacity is taking far longer to augment. Even in the efforts we made, those haven't worked. Come the 3rd of May, should this lockdown be extended in your view, in the absence of adequate ramping up of testing capacity, or can it be eased or ended?
So I think places where you clearly have hotspots, you should not be easing. In places that don't have hotspots, you can ease, but you have to know you're doing it in the context of not enough testing, so you are not sure. There's no easy answers here. I don't think you can just extend the lockdown indefinitely. The impact on people of India, especially the poor, has been so great that I think some easing of restrictions in those areas makes sense to me.
But the fear that various people like Ian Lipkin had, the moment you ease restrictions, there'll be more intermingling amongst members of society, and then you could have a hockey stick-like rise in the number of infections. So you're back to square one, and all the effort you made in this lockdown, which is what the editor-in-chief of the Lancet Medical Journal told me as well. So all the effort you've made pretty much goes waste.
No, so let me be a little bit more optimistic than that. First of all the effort that has been made has slowed the infection rate down. I think that is valuable. I'm not saying that you ease and have everybody go back to normal. That would be a very bad idea. You still need to keep a certain amount of social distancing in place, no large gatherings, no crowded theaters, some amount of economic activity back, especially in areas where you're not seeing cases. But I agree with the Lancet editor, this is very risky. The only way to have it be low risk is if you have testing. So I don't have a third solution, except the government has to ramp up testing. There is no third way out of this.
Dr. Ashish Jha, for taking out time from a very busy schedule, thank you very much. Deeply appreciate.
Thank you.
I want to go across to Dr. Jaiprakash Mulayal, who's looking at what's happening in India. And last time you had a contrarian take, which many people spoke about after you'd finish speaking to India today, Dr. Mulyal. Given the evidence at hand at this moment, do you believe this lockdown needs to be extended? Should it be ended? What's your view, sir? Welcome.
Well, I don't have to elaborate the hardship a lockdown produces to an average Indian family. I'm talking about the daily wage earners and things like that. So it's very obvious. There is an economic hardship. Agriculture is in trouble. Health-wise, there are other implications. And so it's quite an expensive thing. Now, remember, this particular lockdown does reduce transmission of the disease. And if we could harmlessly continue lockdown and go on and on and on, locked up in our rooms for a prolonged period, if it were possible, I suppose that is the cheapest way, but there is no end in sight for that, because every time you release the lockdown and start activities, there will be rise in the number of cases.
So if there's a rise in the level of cases, again, Dr. Mulyal, how then should India deal with the situation post the 3rd of May? You're saying it's almost inevitable that cases will surge no matter when we ease the lockdown. So what should we do post the 3rd of May, sir?
The thing is, the priority areas where we need to focus on, and as you are aware of, are primarily our industries, our agriculture, most important of them, services. These are all what make a living worthwhile. So if you don't have the income generating process, you can't have many of the families really surviving with dignity. So I think we have to be cautious. When we open up, it doesn't matter where you're opening up. You know, each place is at a different state of evolution, different rate of infection. Now, they're all tracking towards one similar point. Some will reach early, others will reach slowly. The rate at which we reach that end point, and I've described the end point in different of my discussion, virologically and epidemiologically, the end point that we anticipate is the threshold value of herd immunity or community immunity.
Interesting that you make this point that you have to work towards community immunity or herd immunity. Dr. Santosh Ansumali, you've heard two different perspectives. You've been doing a lot of modeling with the principal scientific advisor to the Government of India, K. Vijayaraghavan. What's your sense of what the government should do? How are you looking at where we are at medically?
Yeah, first of all, I would like to thank you for inviting me here. And then a clarification. The study we have done is a purely academic exercise, and it's not an official principal scientific advisor office initiative, though we are getting support from them. Yeah. Now,
a sense of what we need to do post the 3rd of May.
Sorry?
What should India do post the 3rd of May?
Yeah, so first let me describe part of the data. We were looking at the data today, and before lockdown versus post-lockdown, the difference is something like this, that if we were before lockdown trajectory, in 4 weeks from now, we would be probably close to 250 times larger than today's infection.
Wow.
On the other hand, because of the lockdown, the exponent has slowed down quite a bit, and it has come down to close to 20 times. So that means lockdown is effective. That's the good part. The bad part is in last 1 week to 10 days, we are seeing evidence that it's actually too leaky now. So it's already sign of lockdown breaking is visible. Maharashtra is one good example. And as previous person said, I would also prefer that looking at these data, we should go kind of phased manner release. Because what are the options? Do we have hospital infrastructure to take a sudden load? My answer would be no. I don't think that we can suddenly open up everything and let a sudden increase happen.
Okay, so I see what you're saying, that it cannot be a sudden easing of the lockdown. It has to be phased, it has to be gradual. There are problems with that as well. Remember, this is one of the trickiest exit strategies the government needs to work on. So there's no easy binary, yes, no, lockdown, end or ease. There's a very complicated strategy. We'll keep tracking that very carefully. Thank you very much for joining us, Professor. I want to tell you about something special that we're lining up for Tuesday, 7 p.m. This is the grand finale of the India Today e-conclave, which has been just such a smashing success. Thanks for all your feedback, your encouragement. Tomorrow we will have one of the greatest chroniclers of our time, the iconic New York Times columnist Thomas Friedman, talking to us on The World Is Now ... You remember his book, The World Is Flat? If he were rewriting a book on today's globalization, what would the title be? Understanding the New Globalization. 3 times Pulitzer Prize winner, one of the best known storytellers of our time, Tom Friedman. Tomorrow at 7 p.m, tune in live for this gala finale of the India Today e-conclave. This is where I wrap up tonight. Rajdeep Sardesai is up next with News Today. Goodbye. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.